Welcome to the final section of Hazardous Drugs and Your Safety, balancing cutting-edge medicine and team welfare. We've learned about how hazardous drugs can pose a risk to your health and your client's health. We've also learned about personal protective equipment and closed system transfer devices to decrease that risk. Now it's time to wrap up with what you can do to keep yourself, your team, and your clients safe. Safety for everyone. Obviously, the safety of your patient is paramount, but that isn't what we're focused on today. You always put your patient safety first, so we're going to focus on what you can do beyond that to minimize harm to yourself, your team, and your clients. Is there a risk? With amazing veterinary cancer therapy advances comes risk. As more clinics use chemotherapy to help their patients, this increases the risk of cytotoxic exposure in the workplace and the patient's home environment. Even if you're mostly careful, adverse effects still can be seen at lower levels of exposure. Chronic low levels of cytotoxic chemotherapy exposure may actually have a higher risk than intermittent high-dose exposure. The risk for your veterinary team is real. In one survey, 71% of veterinary practices use cytotoxic drugs. In a review of several studies examining the cause of death in veterinarians, an increased risk was found for the development of multiple myeloma. This raises the need for further investigation and increased hazardous drug awareness. The risk to your owners is also real. It is agreed that there is a risk to clients while caring for their pets with cancer or administering cytotoxic drugs. The exact risk is poorly defined, meaning there are no specific statistics to quote. In human medicine, some contamination of the environment and potential exposure to family members or caregivers occurs when people are receiving chemotherapy. Guidelines for safe handling of oral chemotherapeutics in human practice have been compiled, attempting to limit potential harms. In veterinary medicine, some environmental contamination also has been documented, and similar precautions should be taken by clients handling veterinary cancer patients undergoing chemotherapy and administering drugs at home to their pets. Where can cytotoxic exposure occur in your clinic? Staff exposure to cytotoxic drugs can occur at many points: handling, preparation, administration of medications, handling pet waste. Your pet owner's exposure to cytotoxic drugs can occur in certain circumstances. Administration of medications. Any thoughts on the other main area of exposure? You guessed it. Excretions, pet waste, secretions, or vomit. Overall, the main routes of hazardous drug exposure include skin contact, skin absorption, inhalation of aerosols or drug particles, ingestion, and needle stick injuries. Before handling any hazardous drugs, ask yourself these questions. Have I received training? Is this training documented in my files? Only trained personnel should handle and administer chemotherapeutics. Choose a safety officer to help your team feel confident and zen. A safety officer should be designated with responsibility for training, documentation, and continual review at least every 6 months, and updating manuals as needed when new guidelines become available. Written policies and procedures for the safe handling of hazardous drugs must be in place. Training should be documented in staff personnel files, and for owners, training should be documented in medical records. A key element of the safety program is the availability of safety data sheets. The Occupational Safety and Health Administration guidelines state that healthcare facilities in which hazardous drugs are used must provide worker training, adequately label hazardous drugs, and provide access to safety data sheets for all hazardous drugs used in the hospital. All employees must be trained on the proper care and use of PPE and spill kits. Workers should be trained to wear proper PPE during hazardous drug receiving, storage, preparation, administration, disposal, and in cleaning up waste from patients that have received hazardous drugs. Closed system transfer device training. Proper use of closed system transfer devices to ensure containment of hazardous drugs during compounding and administration, and methods of preventing aerosol formation and spread of contamination should be taught. But stop and ask yourself, do you have a dedicated hazardous drug unpacking and storage area, dedicated hazardous drug preparation area, dedicated hazardous drug administration area, and a dedicated hazardous waste container? Your dedicated environment. The chemotherapy environment should be set up so as to limit direct exposure to hazardous drugs and decrease the risk of indirect exposure by contaminated packaging, poor handling technique, and spills. All equipment, counters, and work surfaces should be cleaned with a deactivating agent and cleaning agent at the start of the day, before and after each activity, and at the end of the work shift. Does this look right? No. Learn the right way to handle a spill. Policies and procedures regarding drug spills should be established, and employees should understand how to recognize and manage a spill. There is no known safe level of exposure to hazardous drugs. Workers who are pregnant, breastfeeding, or attempting to conceive or father a child should avoid exposure or decrease exposure to as low a level as possible. They should not assist in preparation or administration of hazardous drugs, nor should they handle patients or clean cages of patients that have received chemotherapy. These workers should be offered alternative duties if they choose not to work with cytotoxic agents. All staff should know which patients are receiving hazardous drugs. The duration of excretion of cytotoxic drugs has not been established for most drugs in veterinary patients. Drug may be expected to be found in urine, feces, saliva, vomitus, and sebum. Detectable concentrations of drug have been found in the urine for days to weeks after administration. Many drugs are eliminated in the feces, and differences in oral bioavailability may result in drug excretion for 5 to 7 days post-administration. Most oncologists consider the first 72 hours to be the time period of highest concentrations. The true level of risk from exposure to excreted products is not known. Employees who will be exposed to the patient's waste, urine, feces, vomit, blood within 72 hours of chemotherapy administrations, and sometimes longer for some drugs, should wear proper PPE. Let's talk about client safety. Clients who are pregnant, attempting to conceive, or lactating should not be tasked with drug administration or cleaning of any patient excreta. Client consultation with their personal physician is recommended before initiating treatment to discuss any potential contact risks. What else do many owners like to do? Hug their pet, kiss their pet. Can I do this? Is this safe? Should I do this? Part of your essential service is to provide direction and answer those questions. When patients are discharged after chemotherapy administration or hazardous drugs are prescribed for clients to administer, written discharge instructions should include information about safe handling of the pet and pet waste. Are there small children in the home? The presence of small children in the home should also prompt a frank conversation about potential exposure to hazardous drugs. Handling of pets after chemotherapy administration should be with caution. A pet's interaction with children in the home should be supervised. Avoid contact with pet waste and always have thorough hand washing after handling a pet. We need to find that balance, providing optimal patient care for our pets with cancer while also providing optimal safety for those people handling hazardous drugs is a tough balance. The only known safe level of exposure to these drugs is none. When hazardous drugs are part of your practice, move forward with the right steps to create rewarding cancer success stories while keeping staff and clients safe at all times. Use the following summary to create your clinic's own checklist manifesto when it comes to hazardous drug skills, policy, and training. Here's a summary. There are risks of handling hazardous drugs. You need to be able to access written policies and procedures on hazardous drugs. You need to be able to access those safety data sheets. You need to be able to recognize which drugs are hazardous and how to recognize the areas in which hazardous drugs are used. Understanding methods of controlling exposure to hazardous drugs, using proper personal protection, when and why you should be using closed system transfer devices, and recognize the accidental release of hazardous drugs into the environment, how you should manage spills using spill kits, and management of personnel exposure to hazardous drugs, including clients. Thank you so much for joining us on our session on hazardous drugs and managing risks.